Hi, my name is Joshua Blum, and I'm a consulting psychiatrist at Bucknell and Susquehanna Universities. Today, we're going to be talking a little bit about the mind-body connection, specifically in reference to chronic stresses such as racism. Here you're looking at the yin and yang symbol because we're really talking about balance in various ways. These are fundamentally unbalancing forces in the world, and we're going to be talking a little bit about how they affect a person biologically, psychologically, and on a more systemic level in terms of the world at large, as well as some things you might be able to do about them. In terms of how our bodies are put together, our bodies are actually not really designed for chronic stresses. Bodies are much more suited for acute sort of things. Saber-toothed tiger attacks, we got to run away or fight for our life. But when that saber-toothed tiger becomes something that never really goes away, our body kind of still responds the same way. And throughout human history, there have always been chronic stressors: famine, threat of war, disease, various kinds of abuse, discrimination based on race or ethnicity or religion or creed. Body doesn't really necessarily know the difference initially, so it responds the same way. But over time, that can cause issues. Our body always likes to stay in balance. And when a stressor becomes chronic, the organ systems that were designed to get us through that crisis may not necessarily know that. So those changes that happen to various organ systems now may become pathological because they're really designed for a short-term kind of model. For example, in the endocrine system, the hormonal system, we have these parts of our brain like the hypothalamus and pituitary, which will initiate a cascade of events that will lead to more stress hormones like cortisol. The problem is when we bathe in cortisol all the time, that can cause some issues, including some chronic illnesses such as diabetes. And in terms of the nervous system effects, if we look at like imaging studies showing the brains of small children, for example, you can see this even in like the first 1,000 days. It's often a very critical time for child development. So even early on, you can see in people that have been exposed to trauma in a more chronic way, you can see parts of their brain look different. Like for the hippocampus, for example, which is implicated in memory, maybe smaller. The frontal lobes, they're the last to develop anyway. They control things like planning and judgment and other things like that. They're responsible for making us like good citizens, essentially. Those are the parts of our brain that we cultivate through higher education. Those are the parts of our brain that are, it's not only the first part that's taken away when we are intoxicated, but it's also the part we try to cultivate through things like ethics and education, higher education, for example. You work on a lot of those kinds of things. So there's a delay in development there when a person is exposed to trauma, because it's not necessarily adaptive to be able to sit and study for something and really delve into something if your life is in danger. It's much more adaptive to have a brain that's can make decisions very quickly, and that emotional part of your brain that's responsible for basically keeping you alive, if that needs to be more active because life depends on it. Folks who have been exposed to chronic trauma, especially in childhood, tend to have something that looks like ADHD. For all intents and purposes, many times that's essentially what that is. If you look at the immune system, if you ever slog through midterms or finals, you may notice that you're more likely to get sick. In terms of the muscle systems, you may notice that your muscles hurt more. You may be more susceptible to injury. This is a graph that summarizes this in many ways. And the main reason I put this here is because you may not necessarily be able to see the destabilizing stimulus that it mentions here. You may not be able to see the quote-unquote saber-toothed tiger. It may be a more of a concept or an idea, like systemic oppression or something like that. You can feel it, you can feel its effects, and you may be able to feel its effects on your body. And here's some examples of what'll happen on a biologic level. Now here's an example on a more concrete level. What you're looking at here is the diaphragm and the hip flexors. The diaphragm is implicated in breathing, of course, and when we are stressed, we tend to take short, rapid breaths. And so the diaphragm is moving much more quickly than normal. The hip flexors are interesting because they are core muscles that connect the upper part of our body to the lower part, and they will, of course, flex the hip. In other words, pull the knee up to the chest. When we're stressed, there's ways that these two things are connected. So um, the diaphragm, which will be moving more quickly than usual, some of that action will be translated into the hip flexor. And so this big long part of the hip flexor is called the psoas major, shares the same connective tissue as the diaphragm. That's called fascia. That's the coating around muscles. And when that diaphragm is moving more quickly, it's sensed by by the psoas major, and that starts to tighten up as a result. There's a nerve running right through the diaphragm called the vagus nerve, and that controls the emotional tone in your body. And so it'll prepare when it senses the diaphragm is moving more quickly. It'll prepare the body for a stressful situation, and that in turn will affect the hip flexors, and they will tighten up as a result. And if you think about it, it kind of makes sense because that flinch response that we have when we're stressed, this sort of thing, to protect our head, to protect those core organs um, that we don't want getting damaged, the body has to brace itself for impact. So we tighten up, we round out our shoulders, we pull our knees into our chest, kind of like a fetal position. And even if the attack is not physical, our body kind of responds the same way. So people will notice that their back hurts, their neck hurts, because the muscles are tight and they're not getting adequate blood flow. Our body likes to be in balance. So nowhere is that truer than when you look at the spine and the hips, because so there's a lot of muscle groups that are there to stabilize that, because it's so critical for us, especially because we walk on 2 feet. So we talked about the hip flexors. The hip flexors are over here. The rectus femoris is part of the quadriceps, and the iliopsoas, two muscles that form part of the hip flexor group. And when they are, as we mentioned before, when you're sitting, for example, these are already in a shortened position. When you're stressed, they're often in a shortened position, as we mentioned before. But that causes the opposing muscle group to try to compensate, just like a tension bridge. If one muscle group is pulling, the other one tries to keep it in balance by pulling the opposite way. And so the lower back muscles will tighten up as well to try to keep things equal. But that means there's other muscle groups that are opposing these that have to loosen up as a result. So the abdominal muscles and the gluteal muscles have to lengthen up a little bit to keep things in balance. But what ends up happening is that after a certain point, the system can't compensate anymore, and you end up feeling pain. So if you notice this in your life, anybody who's had lower back pain may have experienced some of these things. It's not a bad idea to try to stretch out those hip flexors, particularly if you're stressed, particularly if you have a job or a career, like you're a student, for example, full-time student, and you're sitting a lot. You drive a truck, or you do have a long commute, those kinds of things like that. Stretch out those hip flexors, strengthen up the gluteal muscles, strengthen up the abdominal muscles, try to stretch out your lower back. Those are all great things to do. There's a few caveats to that, though, because everybody's a little bit different. So a lot of, for example, muscle exercises that work the abs, they do it by involving the hip flexors. Those muscles are already tight if you've got these issues. So it may actually be very helpful to talk to an athletic trainer, talk to your primary care doctor, get a referral for physical therapy, because you may want to have an evaluation to look at this in more depth. You can find lots of information like this on YouTube about how to go about addressing these issues, but it may not necessarily be specific for you. So what we're getting at a little bit is personal management of sort of chronic anxiety and its effects on your body. So there's lots of things that you can do, but one of the first things is just this idea of self-compassion, recognizing that some days you're just gonna have bad days, and it's actually okay for that to happen. I mean, there's no positive emotions unless you have some negative ones to balance it out. And in some cases, giving ourselves permission to feel anger, to feel stressed. I mean, that's is the first step toward just acknowledging that this is an issue. You know, those things kind of serve as warning signals, like pain for our bodies, letting us know there's something wrong, and it's our chance to maybe do something about it. You don't have to do this by yourself, though. In fact, it can be very helpful to outsource some of this to other people. For example, like we mentioned, talking to a trainer, a physical therapist, going to see your primary care doctor, finding a therapist or psychiatrist to help you identify and work on some of these issues. Um, one of the aspects of that, however, though, especially in our Western medical system, is that the mind and the body tend to be sort of approached separately. They're viewed separately, and they're often compartmentalized like that, even though it's all you. So there's lots of ways to help reintegrate it, because at the end of the day, it's you that has to live your own life. And as we already talked about, the divisions between what's the mind and what's the body are not necessarily so clear cut when you get right down to it. There's a free app put out by UCLA. It's a mindfulness app that goes through short guided meditations, like 5 to 15 minutes. You can find it on the app stores for iOS and Google. If you go onto YouTube, you can find lots of stuff, various guided imagery type programs and things like that. One of them, called Progressive Muscle Relaxation, is basically a fancy way of saying that muscles relax better once they've done some work. So if you tense up muscles like isometrically and then hold it, it'll be much easier to relax deeply into into a state of relaxation than if you just tried to artificially create that. And if you go on YouTube, you can find lots of great routines to doing that. You can go through sequentially your whole body. It's a nice thing to do because there's lots of ways of getting into a meditative state that allows you to relax and become more centered. But for some people, it's not necessarily going to be sitting in like a lotus position saying Om. There's nothing wrong with that, but it doesn't necessarily work for everybody. So by giving your mind and body something to do, you're just another gateway into getting around your own thinking. We're talking about exercise in various ways, and not surprisingly, exercise is great for lots of different things. Sometimes people underestimate how little it takes. Keep in mind that there were no gyms, thousands of years ago. People built in exercise into their day. And so here's a little study, for example, that looks at what's the best or the minimum effective dose of exercise. Here they're calling it green exercise because they're looking at exercise that were done outside. And they want to see subjectively how long it took for people to feel better. And the answer was 5 minutes. So they were looking at things like, cycling and walking, but also things you wouldn't necessarily think of as exercise, like gardening and camping and things like that. And after about 5 minutes, people subjectively felt better. And the folks who had the biggest response were if they did exercise, by water, interestingly enough, and those who had difficulty, say, with anxiety or depression in some way. So you don't necessarily have to do a lot of it. You don't have to kill yourself when you're doing it. When you look at wider scope, not everybody necessarily is going to be an activist kind of type. Some people are, though, so it really kind of varies. For some people, a huge component of anxiety, particularly if it's dealing with something that they can no longer change, say trauma related to the past or racism or something like that, getting involved and sort of fighting that and educating and being active participants in those dialogues socially, that's really important for them. And that action will cause their anxiety to lessen because they are feeling productive and they're feeling that they're moving forward. For other people, it's going to be the exact opposite. So it really kind of depends on the person. You obviously would know yourself best, but figuring out what works best for you. I think the point is, though, if it's something that affects you, I don't think the point is to do nothing, but there may just be various ways of dealing with it. And someone may say, like, hey, we go to this protest. That may not be your thing, but it may be an easier thing for you to do to work on something else that's more behind the scenes. That's important too. So there's two things, regardless of where you're at with that, when it comes to dealing with big systemic issues that are uh, more along the lines of like social issues that everybody has to deal with. A couple things. So empathy and listening are two skills that we learn as children. They're not necessarily inborn, although empathy is something that developmentally does develop. It's not in infants. We learn it as young children. And once we reach a certain developmental stage, we have the capacity to do that. But we have to work on it. Same with listening. Imagine how many problems in our world could be made a little bit better if we could just listen to each other and without the need for commentary. What we're really getting at here is the idea of education. Hopefully that's part of what we're doing in the schooling process anyway, is broadening our horizons. We all have a tendency to see things initially through our own worldview. For example, personally, I'm a mixed race person, grew up in between two cultures, so it's not hard for me to see the world through that lens. But when I encounter things that are not through that, then I have to educate myself because I may never entirely personally understand what it's like for somebody else um, who grows up in a different culture, that kind of thing. But I can certainly learn about it. So we're ultimately talking about a couple different things here, and I'll end with two quotes. Actionable steps that you may be able to take personally, as well as on a wider basis, to address something that may not be able to be changed so easily. When we look at the effects of, say, trauma, for example, or we look at wider at the social issues, different kinds of inequality, the effects are kind of the effects may be very, very similar, but it doesn't necessarily mean we have to throw up our hands and say, well, we can't do anything because these are such big problems. It may not be able to be solved today. It may take a lot of perseverance and creative thinking, but it doesn't necessarily mean we can't do anything. It's often, sometimes it can be difficult to think of like, okay, well, I'm just one person. What could I possibly do to address some of these big, big issues in the world? I'll end with a quote from Dr. Seuss about that very thing, because it's very easy to get discouraged and to think that nothing you do really makes much difference. But I would say the first part of that is just recognizing what the problems are and recognizing that it is possible to change things, maybe even on a small level in your own sphere of existence. Because unless someone like you cares a whole awful lot, nothing is going to get better. It's not. Thank you.